Hi guys, here's another test question real quick on eating disorders. A nurse is caring for several hospitalized clients with anorexia nervosa. The nurse would be especially alert for which if noted in the client's histories. So here it would be good to know the risk factors or comorbidities when it comes to having a patient with anorexia nervosa. I did a lecture on the three main types of eating disorders: anorexia nervosa, bulimia nervosa, and binge eating disorder. And so you need to know the differences between those three. So check out my other video and it goes over all of those. And the main assessments, nursing interventions, medications, treatments for those, treatment modalities for those three types of eating disorders. So let's go over these answer choices. Letter A, paranoia. Letter B, primary insomnia. Letter C, depression. And letter D, aggression. So what do you think are the, like, comorbidity? What would be a mental health disorder that would coincide or would go along with an eating disorder? Okay, I'll give you a minute and then we'll come back. I'm going to take this time to ask you, please, if you're enjoying these videos, to like and subscribe to my YouTube channel, which is Nursing with Hart, PhD. Hart is spelled H-A-R-T. Okay, let's come back to this question. A nurse is caring for several hospitalized clients with anorexia nervosa. The nurse would be especially alert for which if noted in the client's histories. Okay, so the correct answer is C, depression. And so why do you think it would be especially, the nurse would be especially alert for which of the client's history? Right off the bat, without even knowing the client has an eating disorder, what would be, which of these client histories might have a safety issue? Always thinking about safety. Okay, and the correct answer is C, depression. So depression, think possible suicide. Any client with a history of depression is going to be at higher risk for suicide. Okay, and that would put the client on a special alert with the nurse and the doctor. Okay, let's look over these other answer choices. Just don't match. Paranoia and insomnia, those are not comorbid conditions associated with anorexia. And clients with anorexia have a hard time expressing anger, so aggression would be unlikely. Okay, main comorbidity or client history risk factor for clients with eating disorders is depression. All right, so that's it for now. We'll see you on the next one. Have a great day.